Hello everyone. I'm going to talk you through the third clinical placement formative feedback sheet. The way that I'm going to do it this time is to essentially get you to think about the sorts of things that you should be discussing with your student, and those sorts of things are going to be in blue, and then in red a little bit about what your feedback in each section should really include. Okay. So first of all, we're going to start off with learning objective number one, so learning outcome number one, and that is around knowledge of anatomy and pathophysiology for the whole range of imaging examinations undertaken. So the things that you might want to feed in to your feedback are, of course, the weekly feedback sheets. These are quite important for you, especially if you don't see your student particularly often. They give you an idea of what other radiographers think about the way in which they work. The logbook's obviously necessary from the point of view that it'll let you identify whereabouts your student currently sits with regard to the amount of examinations they've undertaken, and also the range that they've undertaken on their own as well. What you also might want to discuss with your student, which is quite useful, is perhaps some radiographs within the department, if you've got a teaching file or something like that. It is quite useful to kind of get your student to go through what they would do for different pathologies, if they can identify them. Perhaps as well think about getting some rejected radiographs and sort of throwing them into the mix as well, and getting the student to think about would they repeat or would they not. Remember, this whole third clinical placement is around developing the students' skills so that they become first post competent. So the sorts of feedback that you might want to put into this section could be things around sort of identifying pathologies, any areas of weakness in this section, such as, I don't know, sort of things like horizontal beam, lateral hips, those sorts of things, perhaps time in theatre. So this second learning outcome can essentially involve a two-stage process for the student. What you want to get from them is how they interpret clinical information, and also how they would react to that. So this is about anticipation, really. It's about whether or not the student can perhaps see a potential problem coming, and then also once they've interpreted the clinical information, it's about the adaptation of technique as well. Also involved in this particular section is whether or not the students can identify any other imaging modalities that may be more suited to the patient if they can't get the requisite images from them. So some of the feedback you might want to give the students here is you might want to go through a clinical scenario with them and identify weak areas. And you also might want to question them around their knowledge of alternate imaging strategies as well. Now, as you can probably imagine, the holistic approach to patient care and management can be linked in to some degree with the one above, okay, which is around employing a problem-solving approach to practice. Part of interpreting the clinical information, reacting to that, anticipating problems, can also be tied in with their holistic approach to patient care. So can they assess patient capabilities? You might have noticed in the competencies this is also around anti-discriminatory practice. So some of the things that you might want to get off your students here is perhaps a reflection. And also it's not just about the patient's abilities here, it's also about the user, carer, relative. Obviously a good example of this, as I've mentioned before, is around kind of paediatric patients as well. Now, so the sort of feedback that you might want to be given to the students could be with relation to their reflection. You might also again want to look at things like clinical scenarios, again possibly with a different emphasis as to the one above, kind of looking at how best to care for a patient who perhaps has other sort of comorbidities as well. So perhaps asking the student about how other comorbidities can affect patient presentation. So if we move on to number 4. So again, this sort of competency really is kind of reflected in their demonstration of these things. So it's their ability to manage radiographic equipment. So again, a little bit like the first one, you're going to be looking at the weekly feedback and also the evidence sheets as well. So these evidence sheets are from the CT or even the fluoro room and those sorts of things as well. And again, you're tailoring your feedback really for these particular ones to what's being stated by the radiographers in and around those evidence sheets as well. The other thing that you can also look at, of course, with all of these is discussions, because that can be quite important as well. Okay, with number 5, what you're going to be thinking about really is kind of using discussions, and also the evidence sheets. So this is a combination of the two really. So you might want to be discussing things like pathological processes, why patients present in a certain way, what they would have to do to change their technique. Remember to make this quite broad as well. Don't just kind of focus on projection radiography. Think about CT, theatre, anything that kind of is a little bit more advanced. Also think about different types of patients as well. Okay, so different types of patients, it's always useful for the students to be aware of that as well. So again, the sorts of feedback that you're going to want to be giving your student around this area could perhaps be direction to other sources, particularly kind of around pathological processes and those sorts of things. You might also want to think about if they are struggling in this area, and actually even if they're not, it's quite a nice experience for the students to kind of to sit in with reporting rads, or if you're having a amenable radiologist as well, also with the radiologists. Okay, for learning outcome number 6, what we can do is link that back towards number 1 there. Okay, but what the emphasis I think has to be, particularly with these students, because they're in the 3rd year, the emphasis has to be around the adaptation of radiographic technique, also within and out with the imaging department. So again, what you might want to think about looking at in this particular instance are perhaps within the logbook, particularly around portable examinations, and also in theatre as well. And again, as with all kind of discussions between yourself and your student, Student here can also do things like witness statements as well. Okay. Writing's getting a little bit bad there. So again, within your feedback to the students, again, it might be something around discussing with your site coordinator about extra time. Of course, this can be difficult, simply because the students are all vying for kind of the same competencies and that sort of thing. So it can be a difficult thing to try and map out for them. And again, going back to the one above, any sort of directions to other resources as well. So as we move on to the next kind of set of learning outcomes, again, sound clinical judgment across a range of professional contexts. This obviously isn't just the clinical scenarios that we mentioned before, but it could also be things like radiation protection issues, and just kind of general teamwork and stuff, teamwork and things as well. So this doesn't necessarily have to be purely clinical scenarios, but obviously it depends upon it depends on how you're interpreting the word clinical. Anything that can affect patient management really should be clinical, so this would include things like teamworking. Again, things like the witness statements from other members of staff about how they've worked within the team. Clinical scenarios, you can give them radiation protection scenarios, and then they can discuss that with you. So all of those are they're all okay to have around that particular context. Again, with regards to working as an operator practitioner, again, the weekly feedback. And what you would ideally like your colleagues to be doing is kind of identifying greater autonomy sort of by the student. They're able to articulate why an exam is justified. They're able to undertake the examination with kind of minimal intervention from the radiographer and all of those sorts of things. Again, identifying areas of improvement, and you can also quiz or discuss sort of IRMA or IRR with your students there as well. Again, the communication aspects can again be linked back to some of the things around clinical judgment. I suppose really I should be quite specific there, and it's about the kind of teamwork and aspects as well. The students, you could ask them about any kind of MDT meetings they've been to. They should have at least been to one, and ask them what did they get out of it. Again, in your feedback, it could be simple things such as signposting your students to resources. This one's quite an easy one really to undertake with your student. Really, they should all be providing you with reflections. Ideally, they should be based on a model, and the model by the third year should be kind of sort of more complex. They should be getting more out of their reflections. And also the model should also be applicable to the learning experience as well. The ability to utilize the IT, so this will be things like using the RIS and the PACS. You can quiz them on things like confidentiality, which is probably spelt incorrectly there. Confidentiality, patient data, all of those sorts of things should really be interrogated in that one. And then finally, as you can imagine, number 12 there is really it's a summation of all of the above. And really, the only person who can sign that off is the site coordinator or their nominated deputy as well. The site coordinator will sign that bit off online as well. But obviously you can give the student feedback in that area should you so want to. So the student comments and the mentor comments, the biggest thing we can put here is this is sort of a reflection on the meeting itself, how far the students got to go, etc. Your professional progress to date should be fairly straightforward. And also, like we said in the action plan previously, you should be specific when you're giving your feedback to the students. Okay. Like we said at the end of the one for filling out the second year bipartites, you need to tell the students what they need to do, and also how you would like it evidenced, how you want it evidenced. That's quite important as well. And then of course you've got your signatures and your date as well. All documentation is really important to be filled out correctly, to be filled out timely, as this is a record of the feedback that you've given to the students as well.